this is the longest tract starting from the motor cortex and reaching the last segment of the spinal cord. The pyramidal tract fibers pass from the motor area to the spinal ventral horn and to the motor nuclei of opposite side. The pyramidal tract fiber to the spinal ventral horn cells constitute the corticospinal tract. The pyramidal fibers to the motor cranial nerves, that is 3, 4 in the midbrain, 5, 6, 7 in the pons, and 9 and 12 in the medulla constitutes corticobulbar tract. See the origin of corticospinal tract. 30% is from the motor cortex, that is area number 4 in the precentral gyrus. 30% is from premotor area, that is area number 6, and 40% is from somatosensory area itself, that is somatosensory area 1 and 2. Course of pyramidal tract. The pyramidal tract fibers arise from the bed cells of cerebral cortex. They converge towards brainstem as a radiating mass of fibers called corona radiata to reach the internal capsule. In the internal capsule, it lies in the bend, which is also called as genu, and the anterior 2/3 of the posterior limb. In internal capsule, the PT fiber get intermingled with the extrapyramidal fibers, that is EPT, and therefore lesion in this region includes both pyramidal tract and extrapyramidal tract fibers. In midbrain, it lies ventral to the substantia nigra, occupying the middle 3/3 of this region. In pons, they occupy the most ventral aspect in front of the trapezium. Here, the compactness of bundle is loosened. In medulla, they are scattered fibers and are reunited to compact bundle. This compact bundle now produce an elevation in the medulla, which is called as pyramid. In the lower part of the medulla, 80 to 85% of the fibers cross to the opposite side and enters the lateral white column called lateral corticospinal tract, which are crossed and indirect, and it extends throughout the spinal cord. And about 15 to 20% of the fibers, they do not cross and enter anterior white column near the median fissure called anterior corticospinal tract, which are uncrossed and also called as direct fibers. Through interneurons, they cross the midline, and when it reaches the level of muscles, it controls, and it does not extend beyond the lower cervical or mid-thoracic region. So this is the diagram showing of the pyramidal tract, which are going to arise from the primary motor cortex, somatosensory cortex, and supplementary area, and from they form corona radiata, so which passes through the internal capsule, and these fibers subsequently they descend into midbrain, pons, and medulla. In the medulla, almost 85% of the fibers they decussate to form a lateral motor tract, and which are going to innervate the anterior motor neurons till the lowest part of the spinal cord, whereas some of the uncrossed fibers they are going to descend into the anterior white column, and from there they are going to go to the opposite side of the spinal cord to innervate the muscles, and these fibers reach up to only the cervical or thoracic part. Functions of pyramidal tract. Lateral corticospinal tracts convey the motor impulses to the spinal cord for controlling voluntary movements, especially fine and precise movements of fingers and hands to carry out skilled work. Anterior corticospinal tract controls the muscles of trunk and proximal portion of the limb to carry out the postural adjustments and gross movements. Corticospinal fibers arising from the somatic sensory area, that is area number 1 and 2, and parietal lobe association cortex are concerned with the sensory motor coordination. Some corticospinal fibers end at excitatory synapses on alpha and gamma motor neurons, whereas others end on the interneurons that may excite or inhibit the alpha motor neurons and thus controlling the alpha motor neuron activity. Corticobulbar fibers are responsible for voluntary controls of muscles of larynx, pharynx, palate, and upper and lower face, jaw, and